this leads our bulletin. Healthcare workers who received their COVID-19 vaccines in the Sisonke trial are able to get booster shots from today. There's contention, though, as some say they're being used as guinea pigs. Others are complaining they're being forced to take the Johnson & Johnson jabs. For more on this, I am joined by the Health Department's Acting Director General, Dr. Nicholas Crisp. Thanks for your time. Before we get into the controversy of it all, just tell us how day one went.
Good evening, Shehan, and good evening to your viewers. So I understand it's gone reasonably well. We wanted to start yesterday, but there were some problems with load shedding in various places, so we couldn't get going. I don't have the actual figures today, but I saw that over 60,000 of those who received messages did register to get their codes for vaccination.
Yeah. So let's talk about what we heard from some healthcare workers today, right? And this is very concerning, given that we spoke to them. I would like you to take a listen about them apparently being used as guinea pigs, and then we'll talk after.
To be a single shot is now posed to be, we now need a booster shot. The education on the ground remains very much unclear as to what then changed. Are we still sticking with saying the efficacy of these vaccines were on point, or it's just another trial that is going to end up being every 6 months, every yearly booster? What is out there? What are we not telling the healthcare workers, as we are saying they must come to the forefront and be these guinea pigs? But secondly, our biggest concern is that there's been adverse effects of these drugs experienced by healthcare workers. And the healthcare workers are saying, give us the numbers. The reports have been put forward. Why are we being silenced from telling or speaking, openly about the challenges that we've experienced with this jab?
Yeah, so if you listen to that, there's some concern, of course, by healthcare workers who are saying they weren't given enough information about the booster shots and that they're being used as guinea pigs. What do you say to that?
Well, I think it's very unfortunate when healthcare workers don't read the circulars and aren't able to get the information which has been in the public space for months. I think if you spoke to more experienced and older healthcare workers, they might give you a different view. So certainly the doctors and those that we interact with in hospitals across the country are well aware of what this is about, and they have their own views on vaccines. But be that as it may, I think if people don't know what's going on, we should provide the information for them, and they're not being used as guinea pigs. We've known for months that it is recommended globally that Johnson & Johnson vaccine efficacy does wane over time. All vaccines seem to wane over time. And the question is, at what point does one offer a booster vaccine? There is some discussion in the global space about whether Johnson & Johnson as an Ad26 vaccine should in fact be a 2-dose vaccine and not a 1-dose vaccine. And we will get that information in the weeks and months ahead. So, I think the fact of the matter is during COVID, we are in a dynamic and changing scientific and clinical environment. But the vaccine definitely works. It works well. And there's been demand from healthcare workers, not reticence, demand from healthcare workers for booster shots. And so that's why we are giving them booster shots.
Yeah, absolutely. And this, of course, is part of the Sisonke trial, right? So there are 500 doses that you do have. Is government looking at extending that after this trial for other healthcare workers?
Yes. So let's be clear. We have just over 500,000 doses of vaccine that has been made available to us free in order to vaccinate the healthcare workers who were vaccinated between the 17th of February and the 17th of May, or 16th of May. That is the Sisonke 1 study. The reason why we went for a study is because this is an emergency release vaccine. And so we needed to go back to SAPRA because we need the regulator to say that it should be another vaccine should be given as part of the regimen of the vaccination of Johnson & Johnson vaccine. So the Medical Research Council was asked if they would put the study together so that we can then monitor over time and get information about how valuable this is in a big real-life setting so that we can estimate whether we need to do this in the general population or whether it's only really necessary for the high-risk environments like healthcare workers. After this, there may be need for, the results may show us that we need to vaccinate the remainder of the healthcare workers, in which case we will go ahead and do that. There's also new evidence that other vaccines, the mRNA vaccines, such as the Pfizer vaccine that we use now, may be even more effective than the Johnson & Johnson booster after the Johnson & Johnson Ad26 vaccine. So going forward, we are going to embark on a study. Again, we need to put it together and take it to the regulator. And we may well offer vaccination with the mRNA vaccine that we are using, the Pfizer vaccine, as a booster to Johnson & Johnson. Of course, there's still a possibility that we may need to boost the Pfizer vaccine in the new year as well.
Yeah. And of course, all of those studies are ongoing. Just tell me, for ease of mind for those who are taking the second Johnson & Johnson jab, what is the efficacy after that second inoculation?
Well, one hears and sees various figures, but it seems to be somewhere between 70 and 75%, which is marginally less than has been recently reported on Pfizer. But we've known this figure for some months now. And it's on the basis of that you get a 75% efficacy on the second dose that we decided that this is a good thing to offer to healthcare workers. Because the healthcare workers are the ones who have to be in the most vulnerable and dangerous environment should we get a fourth wave, which we suspect will happen at some point towards the end of the year.
All right, while I have you, can we talk about the vaccination process for all South Africans? Last week when we spoke, of course, you were saying we hadn't reached the target, the daily target, to get as many people as 250,000, I think it was, inoculated every day. What's it looking like now, a week later?
Yeah, Sharon, it's still a disappointing daily tallies that are between 105 and 130,000 a day, which is way less than we would like it to be and way below our combined capacity. So that's very disappointing. But we are getting closer to the 24 million mark of vaccinations given. And there, of course, now we are vaccinating children as well between the age of 12 and 17. So the numbers that we are really hoping to get up are in older people between the ages of 50 and 59 and 60 plus. Those are the people we want to really make sure are vaccinated to keep them out of hospital and from severe illness. That's now our primary target as we move towards the end of the year.
So 105,000 to 130,000 a day, that is very low, right? Are we wasting a lot of vaccines?
No, we don't waste any vaccine. Remember, the vaccines are thawed and then they're frozen and then they get thawed as we know we're going to need them. So we don't, in fact, the wastage that we measure, what we call avoidable wastage, is sitting below 1% across the country, which is very good on a vaccination program. It differs from one district to the other depending on the logistics and the fridges and so on. But the collective amount that we lose is under 1%. So no, we're not wasting. We have about 12 million doses in the country at the moment, which with the committed deliveries will take us through about another 6 months at the current rates of vaccination.
All right, thank you so much for your time and your insight. Always a pleasure talking to you. The Health Department's Acting Director General, Nicholas Crisp.